Thank you so much for doing this. I'm very honored. And I've listened to you on other people's podcasts, including Rick's Roll. And it's a pleasure to listen to your voice. You have the ideal voice for hypnosis. You're in the right profession, certainly.
Thank you.
I know you are short on time, and I have lots of questions to ask you. So if I can dive in, really, I suppose that's the best thing.
Please do.
Well, first of all, can we define what hypnosis is, and more importantly, what it isn't? Because the public perception is that it's gone full circle from Anton Mesmer treating ailments clinically 200 years ago, and then jumping ahead in time to when it was hijacked unceremoniously by hypnotists on stage. And then in recent decades, it's reestablished itself in a clinical environment.
Well, that's a good summary, Matthew. Hypnosis is the oldest Western conception of a psychotherapy. It's the first time a talking interaction was thought to have therapeutic potential. But it's either been dismissed as, nonsense or a sideshow, like with these stage hypnotists, or viewed as terribly dangerous. When cars were invented a century ago, they didn't want, some states were passing laws making windshield wipers illegal because, remember, the old dangling watch thing. So the idea was that people would watch the windshield wipers and go into a hypnotic state. I finally met one person to whom that happened, but she was very hypnotizable. And in general, the answer is no, it doesn't happen. Hypnosis is just a state of highly focused attention. It's like getting so caught up in a good movie that you forget you're watching the movie and you enter the imagined world. So you become part of the story rather than the audience. And in that state of highly focused attention, you suspend your sort of scanning awareness. We turn down activity in what's called the salience network. It's the part of the brain that gets you to shift your attention when you hear a loud noise and you're afraid it's a gunshot or something like that. At least in the United States you are. And it allows you to immerse yourself in the experience. The brain is a very complex organ, and there's no reason why it should work the same way all the time. And so in hypnosis, you narrow attention, you get fully engaged. That means you dissociate. You put outside of conscious awareness things that would ordinarily be in consciousness. So right now, for example, hopefully you're not aware of the sensations in your bottom touching your chair. If you are, we can stop the interview now. We do it all the time. We turn off input from parts of our sensory or other experiences that we just don't want to be bothered paying attention to. You do that more intensely in hypnosis. So you literally separate awareness of what's happening in other parts of your body or other thoughts or things you might be concerned about. And the third thing is what has scared people the most, Matthew, and that's the idea of suggestibility, that somebody can talk you into anything. What you are doing is deferring judgment about things, and we're calling it now cognitive flexibility rather than suggestibility. You're open to thinking about things in a new and different way, and we've done some research showing that people who are highly hypnotizable don't perseverate as much. They don't, Ralph Waldo Emerson said, a foolish consistency is the hobgoblin of little minds, the province of poets, philosophers, and divines. And the idea here is that you can learn and benefit from this kind of cognitive flexibility, from saying, you know what, I've always done it this way, but maybe there's another way to do it. And rather than worrying about the conflict, you just go with the new idea and see where it takes you. And so on the one hand, the bad news is that's why the football coach danced like a ballerina at the stage hypnosis show. But it also means that you can approach an old problem from a new point of view more easily. So for example, when I get people to use hypnosis to stop smoking, I don't say don't smoke. That's like telling yourself don't think about purple elephants. It's rather saying, why don't you focus instead on protecting and respecting your body? Think of your body as if it were your baby or your pet. In fact, your body is as dependent on you as your baby or your pet is. In fact, more dependent. Anything you put into it, it has to take into it. So feel good about yourself because you're shifting to a frame of respecting and protecting your body. So you don't feel like you're depriving yourself. You feel like you're enhancing who you are and what you can do. And so when you're in hypnosis, you're more likely to just accept and try out that new perspective.
You mentioned ceasing smoking there. That's something that your app Reverie caters for. We'll come back to that
Yes.
in a little bit, if you don't mind. Can we talk about the mind-body connection? It's something that's really interesting. I just read Dr. Jeff Rediger's book, Cured. He actually name checks you in the book. And he speaks at length about the power of the mind over the body and over illness. And as proof of that mind-body link, can you tell me about that young girl that had the asthma attack
Oh,
at the
yes.
very start of your medical career? That was a milestone in your career.
It was. It was a turning point for me. I thought, I have got to pursue this. This was, I was on my pediatrics rotation when I was in medical school at Harvard, and I was at Children's Hospital. And the nurse says, Spiegel, your next patient's in room 243. She's got status asthmaticus. And so I just followed the sound of the wheezing down the hall, and I walk in, and there's this pretty 15-year-old, bolt upright in bed, knuckles white, struggling for breath. You could hear her wheezing. Her mother standing there crying. They had tried subcutaneous epinephrine twice. It hadn't worked. The next step was going to be general anesthesia, and then starting her on steroids. And I didn't know what else to do. So I thought, well, I just started my hypnosis course. Maybe I'll try hypnotizing her. So I said, you want to learn a breathing exercise? And she nods. So I get her hypnotized, and then I realized we hadn't gotten asthma in the course, which was a problem. So I came up with something very clever. I said, each breath you take will be a little deeper and a little easier. And within 15 minutes, she's lying back in bed. The wheezing is gone. Her mother stopped crying. The nurse ran out of the room. And my intern comes looking for me, and I figure he's going to pat me on the back and say, what'd you do, Spiegel? Instead, he said, the nurse has filed a complaint with the nurse supervisor that you violated Massachusetts law by hypnotizing a minor without parental consent. Now, Massachusetts has a lot of weird laws, but that is not on the list. And her mother was standing next to me when I did it. So he says, well, you're going to have to stop doing this. And I said, oh, really? Why? He said, well, it could be dangerous. I said, look, you're going to give her general anesthesia and steroids, and you think my talking to her is dangerous? Take me off the case if you want, but as long as she's my patient, I'm not going to tell her something I know isn't true. He left, and there was a council of war among the intern, the resident, the chief resident, the attending. And they came back on Monday morning with a radical idea. They said, let's ask the patient. I don't think that had ever happened before there. And she said, oh, I like this. Now, this girl had been hospitalized every month for 3 months in status asthmaticus. She did have one subsequent hospitalization, but went on to study to be a respiratory therapist. And I figured that anything that could help a patient that much, that fast, that safely, violate a non-existent Massachusetts law had to be worth looking into. So I just kept doing it. It was right before my eyes, just a few minutes, and she's feeling tangibly better. And so I just thought, we have been overlooking the ways in which we can use our minds to better deal with our bodies. And, the mind is an extremely complex thing, but it doesn't come with a user's manual. It's not intuitively obvious all the things you can do with your mind, and you got to learn some of them. They don't just come naturally. And hypnosis is one good example of that.
What other ailments is hypnosis good for treating? I know it's particularly efficacious when it comes to dealing with pain.
Yes, you're exactly right, Matthew. It's one of the best known attributes of hypnosis because it allows you to actually alter your perception of pain. We've done studies with EEG showing that we can reduce within 1/10 of a second the strength of the brain's response to a series of shocks that are being administered. So it's not simply that you think differently about the pain you're feeling, you actually feel it differently. The way I like to tell the students that is that the strain in pain lies mainly in the brain. What pain is a combination of potentially tissue injury, a broken ankle or something that gets transmitted through the lateral spinal thalamic tract, through the periaqueductal grade of the somatosensory cortex, and how the brain interprets and pays attention to that. And we all know that, if you're really scared, you're more likely to pay full attention to the pain. We humans are fairly pathetic physical creatures. We don't run that well. We don't see that well. We don't smell that well. We don't hear that well. And our major defense against predators was to be able to control our response to injury and fear. And so if you can freeze instead of scream and run, you're less likely to be detected and killed by a predator. And so the capacity to modulate pain is not only merciful, it adds to survival. And so people can learn to modulate pain. I mean, women have given birth to children throughout human history without anesthesia, without epidurals and all the other things that we do. My wife gave birth to our 2 children with hypnosis as the anesthesia, and I had no pain at all. She had very little pain. And our son was 10 pounds when he was born, first child. It is possible to substantially modulate pain. And so we published a study in the Lancet, leading British medical journal, 241 women undergoing arterial cut downs to chemoembolize tumors in the liver or deal with artery obstructions. And it takes about 2.5 hours. You don't use general anesthesia for it. It's very uncomfortable and scary. And we randomized them into 3 groups. One was standard care. You push a button, you get opioids in your blood. The second is that plus a friendly nurse to control for, emotional support. The third was training in hypnosis. And what we found was that after an hour and a half, the average pain levels were 5 out of 10 in the standard care group, and 1 out of 10 in the hypnosis group, 3 out of 10 in the nursing support group. The anxiety levels were 0 in the hypnosis group after an hour and a half. I thought they were all dead or something. They were just fine. 5 out of 10 in the standard care group, 3 out of 10 in the nursing group. The procedures got done 17 minutes faster in the hypnosis group than the other 2. And they had far fewer complications, and they used half as much opioids during the procedure. So they were feeling better, they were happier, they got done quicker, they had fewer complications, and used half the medication. Now, if I had another drug that did that, and that was published in a randomized trial in the Lancet, every hospital would be using it now. Are they? No. And so, it's not a question of the science anymore, Matthew. I used to think just, build it and they will come, provide enough science. My colleagues and I have been working at that for decades. We've done it, and it hasn't changed the utilization very much at all. And that's why we started Reverie, is to go direct to consumer, to get people to try it for themselves.
Now, this is your app, which is available on the Apple iStore, as far as I'm aware. I know you can treat people who have a smoking addiction, for example. What other things does this app do?
Sure. It's available at the App Store, and also if you have Android phones now, it's available at Google Play. So either of the major places you can download it and use it. And we help people stop smoking, as you mentioned, focusing on respecting and protecting their bodies. We've so far gotten 1 out of 5 people to stop just listening to the app, which is about the same level as you get from the drugs that are used, varenicline and bupropion, for smoking abstinence. So it's not bad. We have stress management techniques. So one of the things we do, Matthew, is part of the problem with stressors, and Lord knows we got enough of them these days, is the translation of the stress situation or threat to the way our bodies respond to it. So as I mentioned, our major reaction to stressors is to fight or flee, but most of the stressors we face now, thank God, are not physical, they're emotional. Nonetheless, your heart rate goes up, your muscles tense, you start to sweat, and then you notice that and you think, oh my God, this must be really bad. And so the stress gets worse, and then it's like a snowball rolling downhill. With hypnosis, you can first get your body comfortable. So I have people imagine they're floating in a bath, a lake, a hot tub, or just floating in space. And I say, first, let's take care of your body. Imagine you're floating and comfortable in this way, and then use an imaginary screen to picture on one side the stressor and assess it, see what it's like, but with the rule that you don't let your body get caught up in it. So already you're beginning to change the effect of the stressor, even though you haven't changed the stressor at all, because you're able to control your reaction to it. That's valuable. Then I have them use the other side of the screen to brainstorm possible solutions. What could you do about this problem? And it doesn't mean you come up with the best thing, but you begin to feel that you've got a step-by-step strategy for dealing with it. So it can be very useful, and the Reverie app takes people right through it. It's interactive, so that I'll ask people, is your hand feeling light? Are you feeling comfortable and floating? If they say yes, we go on to the next step. If not, I help them get to that point where they can do it. So it's more like a trip to my office than it's not simply just a flat out recording. It's an interactive experience. We help people intensify their focus to focus on what you're for, to focus on what you want to pay attention to, rather than jumping around. In mindfulness, they call it monkey mind, jumping from one thing to another. You can enhance your focus, which is what hypnosis is really good at doing. We have exercises to help people eat well, to eat with respect for your body, to enjoy eating more, but actually eat less. We have an app to help people control their drinking for people who are having trouble with that. Again, protecting and respecting your body. And we're going to have one out shortly for fear of flying as well. So, and we also have now an interactive automated test of your hypnotizability. So people can get a feeling of how likely they are to be able to respond intensely, although most people can benefit from the exposure to the app, both from the hypnotic state itself and also from the approach to the problem that we've been discussing.
When I was training as a hypnotherapist a few years ago, I learned that we have two minds, a conscious mind and a subconscious or unconscious mind. Does that really exist? Can you see the subconscious mind, or is it something that's nebulous that you can't see whenever the brain is scanned, for example?
Well, the brain is a very complex processor. It manages vast amounts of information. And you can't possibly be consciously aware of all of it. If you were, you'd just grind to a halt. There's just too much going on. So a big part of the way our brains work is to have certain parts of the brain, like the executive control network, the prefrontal cortex, select, choose, and operate on certain aspects of our memory and experience and planning to get something done. That means there's a whole lot of stuff that is not immediately accessible to conscious awareness. And a lot of that is in deeper structures in the brain. It's memories and emotion. That is, when we're trying to solve a problem, we try to put other stuff aside and not get worried about how anxious you are about whether you'll do it right or whether your boss will like it or whatever it is. Or, all the lessons you got from your parents about how worthless and, unable you are to do what you're supposed to be doing. You try and put that aside and deal with solving the problem. But your emotional set, your memories of what's happened when you've done things like this before are all there, and it's not like they're gone. So negative expectations, hopelessness, sadness, depression can influence how well you perform, but they don't always do it directly. You may not even be aware of it, that your difficulty solving a problem is because it reminds you of a situation where you had a big problem in school or with your parents a long time ago. So I would say that the unconscious is a kind of shifting field. It's something that is always a part of our experience because we can't possibly be consciously aware of everything that we have experienced and that we know and that we feel. Clearly also the nature of the emotions and the memories will bias what you think is important to pay attention to, what you think you may have trouble paying attention to. So I would say it's not so much sort of the conscious and the unconscious, but rather the shifting field of what you're trying to do and what are the parts of your brain and experience that are influencing what you're trying to do.
I know that Andrew Huberman is a colleague of yours, and he is somebody I look up to. He's a terrific neuroscientist and a great podcaster. I love his work. Mm-hmm. And I know that you put a lot of emphasis and importance on the importance of breath. And having listened to Andrew recently, he was talking about cyclic sighing in order to de-stress the body, de-stress the system. Now, it seems that breathing is significant in hypnosis, in meditation, in yoga, in Tai Chi. What is it about this significance of breathing? Is it that it has a relationship with the parasympathetic nervous system in order to calm us down? Is it a precondition?
Well, that's certainly part of it, we think. Breathing is interesting because it happens automatically, but at the same time, it's something that you readily control. So the autonomic nervous system controls heart rate, blood pressure, a lot of other things, gastrointestinal function, and we can, in fact, control it, but much less directly than we do when we take control of it. And so it's a kind of access to that autonomic pathway that is at the center of the mind-body relationship. And in particular, you mentioned the parasympathetic nervous system. It turns out that there's a phenomenon called respiratory sinus arrhythmia. It's the way in which the way in which you breathe, inhaling or exhaling, can help to regulate parasympathetic activity. It turns out that it's the parasympathetic, the self-soothing, slow down activation system that regulates heart rate in relation to blood flow. Rather, you'd think it'd be the sympathetic system that, you're ready to fight or flee, your heart rate does go up. But the parasympathetic system is the major regulator of changes in heart rate. And the way it works is this: when you inhale, you reduce pressure in the chest. That's how you inhale air from the outside. That reduces blood flow just a little bit from the superior venous cava into the atria of the heart. And so the heart senses a slight decrease in blood flow, and it thinks, oh my God, I have to beat faster in order to get more blood flowing, to maintain a sufficient flow of blood throughout the body. And conversely, when you exhale, as you do in sighing, you do that by increasing pressure in your chest, forcing air out of your lungs. And the heart gets a message from the sinoatrial node that there's plenty of blood coming, you can slow down. That's the parasympathetic activity. And of course, we're inhaling and exhaling all the time. The variability in heart rate in response to inhaling versus exhaling is heart rate variability, and it's parasympathetically dominated. So the exercise that in our collaboration, Andrew's group and mine studied people who were doing various kinds of breathwork techniques, and one of them was cyclic sighing. And in cyclic sighing, and you can try it if you want, you inhale about halfway, hold it, and now fully inhale your lungs, and then slowly exhale through your mouth. If you try one more time, inhale, hold, fully inhale, and then slowly exhale through your mouth. And I don't know, can you feel it? You can sometimes just feel your body calming. So you're triggering parasympathetic activity, and the capacity to do that is a very rapid and effective way of self-soothing, of calming yourself down. So we tend to think of, soothing as, take a deep breath. Well, taking a deep breath will actually pick up your heart rate, but it's the sighing that tends to slow it down. We physiologically have to sigh every so often to make sure that our lungs completely fill and then completely empty, to keep the little alveoli, the little sacs in the lungs open. But in addition, you can use it as a very rapid way of triggering parasympathetic activity and just helping yourself calm.
I think the listeners probably at this stage are so used to be talking about the parasympathetic nervous system, but it's part of the nervous system that is really underappreciated. And even with myself, I did a degree in biochemistry, and it's only in recent times that I have discovered the importance of that side of the nervous system. It really is undervalued.
You're absolutely right, Matthew. And in particular, for example, to go to sleep. To get to sleep, we have to shut down the sympathetic nervous system. If there's a loud noise at night, that you wake up with your heart going, it's sympathetic activity that wakes you up and keeps you running during the day. But at night, in order to be able to sleep, you have to be parasympathetically dominated. You have to self-soothe. And that's one of the other things we do with the Reverie app, is we teach people how to get to sleep and stay asleep, to get back to sleep if they wake up. it's one of our most popular uses of the app. And, we try to get pre to post ratings of stress and pain and things like that. We tried to get that with sleep, but we got very few, despite many people using the sleep app. And they told us, I didn't want to give you an answer to how sleepy I felt. I just wanted to go to sleep. So they wouldn't tell us about how they were doing. But the parasympathetic system needs to dominate for you to get to sleep and stay asleep.
Your father was arguably one of the fathers of hypnosis in the 20th century. His name, Herbert Spiegel, Dr. Herbert Spiegel, and
Yes.
he lived until the ripe old age of 95, which is extraordinary in itself.
Yeah.
I was familiar during my training with Milton Erickson. Was he a contemporary of your father's?
Yes, my father used to have Milton come and lecture as he had a fabled hypnosis course at Columbia. And Milton used to come and give a lecture there. And, Milton was also a very well-known psychiatrist who used hypnosis and kind of kept it going when there weren't many people interested in it. So yes, they knew one another. There was a story where Milton came for breakfast to my father's apartment. And Milton was always kind of keeping people off balance and trying to kind of trick them into entering a hypnotic state. And so my father opens the door. He had breakfast there for himself and Milton before the class. And Milton says, "Hi, Herb, I brought Betty with me." Now, Betty was his wife. And my father gets sort of nervous. He only had breakfast for two, and he looks around. And Milton just stands there smiling at him. And finally, my father notices he had a bolo tie. He was from Arizona. And he had a picture of his wife, Betty, in the bolo tie, and that's what he meant by having brought Betty with him. And so he was always, doing the hypnosis stuff.
He had a sense of humor, certainly.
Yeah.
Just to put it into context, Milton Erickson, for people who haven't heard the name, is probably one of the most famous names in hypnosis since hypnosis was first used. But certainly in a clinical setting, he was extraordinarily influential. And I read his book, My Voice Will Go With You. And I was stunned by his use of metaphor and language in order to be able to give people hypnotic suggestions. And I'm wondering if you place a similar importance on the use of language in your own clinical environment when you're treating people and using hypnosis in that context.
Well, I do. Milton would tend to be rather indirect. He wants you to get the idea, but not feel that he was just teaching you to do it. I tend to be more direct about it. I just say, for my body, smoking's a poison. I need my body to live. My body, respect and protection. It's pretty direct. Milton tended to feel that the conscious mind was a bit of a nuisance that got in the way, and what you wanted to do was shut it down and let the unconscious solve the problem. And so he would speak in metaphors. He had a young man who was having a lot of family difficulties and rebelling against his parents and all kinds of problems. And he said, "Betty, would you bring me that beautiful tie that you and the children gave me for Christmas?" And so she goes and brings it in, and he says, "What a beautiful tie. Notice the weave and how tightly it's woven and what beautiful colors there are." And he would go on like that for 5 minutes with the patient in a trance. And the inference that he was trying to put across is the importance of family ties. Now, I get it.
Very subtle. Very subtle.
I would tend to be more direct about that, but that was his style. That's what he did. And he had the sort of heart of a healer. He just wanted to find ways to help people make the most of their opportunities to get better. And I admired that, but our approach is rather different.
You were talking earlier about dealing with and treating people with stress and about separating that person from whatever was stressing them or what pain was stressing them. It's the same basic mechanism when you're dealing with people presenting with trauma. You're putting a distance and the person is seeing their trauma from a different perspective. Is that right?
Yes, it's a more intense and complicated kind of treatment, but you're right. It is a different perspective, but it's not. The mind-body part is only one part of it, and that is your when people are reliving traumatic experiences, I say your body is safe and comfortable. You may be understandably anxious, but your body is safe and comfortable. But then I try to have them see the traumatic situation from a different point of view to restructure their understanding of what happened. Most people who are traumatized tend to blame themselves. People would rather feel guilty than helpless. And the essence of trauma is that you're being made into an object, a thing, a victim of somebody's rage or nature's indifference or something else. And it's a terrible feeling. You lose all of your sense of ability to activate and control what's going on. And that's very painful. And so I ask for people, when they think of traumatic experiences, to think of it from a different point of view. So I had a lovely woman, healthcare professional here, who had had escaped from a country that does not treat women well these days. And when she was 12 years old, she was raped by their landlord, and her parents were afraid to do anything. They were afraid they'd get thrown out of the apartment. And as she grew up as a teenager, she said, I realized on the street that my body was not my own, that men seemed to feel they could do or say anything they wanted. And I had her picture herself when she was raped by this landlord. And she started to cry. And I said, looking at yourself now, was this your fault? Did you do anything to incite this? Because she was being blamed, girls like you. And she said, no, she's just a sweet little girl. And I said, well, do what you do if you were her mother. Give her a hug. And she cries some more, and she says, I'm stroking her hair. She's such a sweet little girl. And she had lived with this idea that somehow it must be her fault that this happened. And that's very common for people who've been traumatized. And she called me about a week later, and she said, Dr. Spiegel, my psychiatrist wants to know what you did to me, because I'm not depressed anymore. And she said, my friends don't recognize me. They want to know what happened. And so sometimes if you can use it as a way, as I mentioned earlier, of disconnecting from your customary ways of understanding what happened, that is, somehow it must be my fault. And that gives people the sort of unconscious reassurance that if they just played the movie again, it would turn out different. They could do it differently, which is not the case. So you try and help people face it, but see it from the point of view, not just of what happened to them, but what they did to protect themselves, how guilty or responsible they should feel for what happened. And so sometimes you can use this state to intensely focus on what happened, put aside your usual preconceptions about it, and have a different kind of emotional experience. It's still a terrible thing, but it's different. It's really different. And so hypnosis can be very helpful with that.
Dr. Spiegel, you're a scientist, and you've used hypnosis as part of your practice for the last 40 plus years. You've hypnotized over 7,000 people, I think.
That's right.
Why do you think that hypnosis isn't mainstream still? Is it because it requires more work than popping a pill or a tablet?
Well, you're right about that, Matthew, that it's not a lot of work to get someone hypnotized, but it is more than writing a prescription. I think there's this sort of fundamental prejudice we have that the real interventions are the physical ones, incision, injection, or ingestion. If you're not, we're treating people like they're cars, just replace the muffler or change the spark plugs, and it'll work. That just talking about it, that isn't a real intervention. So I think there's this real prejudice against the less tangible but very effective things that we can do talking to one another, and that our brains can do to manage our bodies. The third problem is money. There's not a hell of a lot of money in talking to people and doing hypnosis. There's a lot of money in drugs. And so there are big companies around to push to have detailed people go out and talk to doctors about try this new drug versus that new drug. I'm a physician. I use drugs. I'm not against using medication at all, but it should be just a part of what we do, not the whole thing. And I think we have systematically undervalued the impact and importance of psychological interventions like hypnosis, as you know from your experience too.
You have written over 400 papers down through the decades. What is the future as far as hypnosis research? What does it involve as far as that's concerned?
Well, we're using functional neuroimaging to, fMRI
To picture
show
the brain.
what happens in the brain, to picture the brain. We've been able to show that you turn down activity in the salience network. It's the dorsal anterior cingulate cortex. So you can pay more focused attention because you're less likely to worry about something else, some other distraction or problem. You increase connection between the executive control network, the prefrontal cortex, and the insula, which is a part of the brain that is a mind-body conduit. It both helps the brain regulate the body, like gastrointestinal function. We were able to show that we could alter gastric acid secretion if people were eating imaginary meals, for example. But it's also a way of processing interoception, from being more aware of how your body is feeling, how your gut's feeling, how tense your muscles are. And so we've also shown that there's an inverse connection between the dorsolateral prefrontal cortex and the posterior cingulate. That's a part of the brain called the default mode network, where you do self-reflection and rumination. So you disconnect from your usual self-reflections, you enhance connection with your body, and you turn down the salience network. That's a great setting for the kind of intense focus that happens. We have a new study just coming out this month, in which we were able to identify particular genes involved with hypnotizability. And it's a point of care test, personalized medicine, where at the bedside, you can actually test and see whether they have the kind of genotype that makes them more likely to be highly hypnotizable. And so we're hoping that by using this high-tech approach to identifying people, we're more likely to be able to say, okay, this person will do very well using hypnosis for pain control or insomnia or something else. So we're hoping to use this modern science to better understand and better utilize hypnosis.
That particular paper that hasn't been published quite yet.
No, it's about out. It's been uploaded, but not the issue of the journal will come out next month.
Okay, I'll get details of that at a later stage, and I'll pop them in the show notes. I'll also pop details to your app, Reverie, in the show notes too.
Reverie.
And I really appreciate you taking the time to talk so comprehensively about your passion on the podcast today. Thank you so much for taking the time.
You're most welcome, Matthew, and thank you for the good work you're doing and for your interest in this field. That's great.